For new mom Abby Krause, with a healthy baby boy, life is now wonderful, but it wasn't always that way.
My first 2 trimesters were very smooth. I didn't have morning sickness, I felt great, I didn't feel tired.
But in her last trimester,
I had anxiety and I had depression.
never knowing anxiety and depression can go hand in hand,
And they seem like polar opposite types of things.
she experienced something many moms don't realize exists.
But I didn't think that prenatal depression was a thing. Because you're supposed to be happy.
It's not postpartum depression, but depression during pregnancy.
Sometimes I wouldn't want to get out of bed, and sometimes I was anxious, and I would get sick in the morning and make myself so upset.
Always wanting to be a mom, she now couldn't focus on work.
I would sit in front of my screen and
She couldn't sleep. Small things seemed enormous. She was overwhelmed.
suddenly I was thinking, I don't know what to do. I'm going to be a horrible mom.
Her mind racing. At times, she thought it was the end of the world.
A lot of times I thought I was being rational. Everybody's like, you're hormonal, you've got the hormone thing going on. I thought, okay.
So Abby turned to the experts at the University of Colorado Hospital and Dr. Cheryl Chesick, Director of Women's Study and Treatment at the Depression Center.
It's called perinatal depression, depression during pregnancy and shortly after pregnancy. 10 to 15% of women will experience a depression during their pregnancy and after.
Saying depression can be common during pregnancy.
You would think it was the hormones or all the life changes of becoming a mom and what that means, and so you may not be aware. For Abby, it just was a piece of not being able to do her day as she usually does and really struggling.
These experts are hoping to create awareness with families and OBGYNs. College of Nursing Director of Midwifery, Erica Schwartz.
I think that women need to articulate how they're feeling, especially to their family or to their provider, because some women will start out feeling more irritable, and instead of writing those feelings off as that they're just associated with pregnancy, they really need to share the feelings that they're having with the family and their providers.
Offering screenings, asking questions, and referring her to the proper doctor.
One of the things that happens, women feel like this shouldn't be happening during my pregnancy, something's wrong with me. So there may be some stigma attached, and just like thyroid disease, depression can certainly happen during pregnancy.
The difficult part, experts tell us the treatment can be difficult during pregnancy, especially with medication.
The medications are more complicated, and so we try to be fairly simple in what we prescribe. But one of the things that's been exciting about the Depression Center is that one of the things that has been of great interest is psychotherapies.
As for Abby, worried about her unborn baby, she chose psychotherapy.
I was really concerned about what was going on in my head and my body. Your head is one thing, but your body is now affecting somebody else.
So I actually took the paper on the exam table and we turned that into a homework sheet. So you have to get a little creative, but I think there are lots of different psychotherapies that are helpful during times of depression.
We ended up doing some sleep aids because they figured it was worse for me not to sleep than to have a sleep aid.
Experts want to make it clear this is something you cannot do yourself, and you must get help from professionals.
But I had also learned some tools from Dr. Chesick about, making lists and calming myself. We did some, mindfulness and some meditation type of things. And
in the end,
great, doing really well. Ironically, I did not have postpartum depression. That was a fear. Everything just cleared up and I felt like my old self again suddenly.
the reward, a beautiful baby boy.
He is 7 months old last week, and he is fantastic. He is just so precious. I hate to say it, but he's perfect. I mean,